Italia, what is different? That's a story, Guru. Italia, what is different? Munda Brauti. Otoire, Nagara Janko. It's also Yaso was in. Nobody, Nubunda, Nakali, Nakayosi, Serami. Ayanara Maya Mombina, Alquari Kuliasi, Ayanara Maya Mombina, Alquari Kuliasi, I keep on way, go down. If you don't get no Ravaiso, okay, thank you. Thank you, my teacher. Up. Tunazidi kuwapokea wageni wetu. Tunazidi kuwapokea. Ameingia gavana wa Kakamega, Mheshimiwa Wycliffe Oparanya. Yuko pia Excellence for Siaya, Colonel Rasanga. Yuko pia His Excellency pia Nawiti, Governor Homa Bay. Na yuko pia Mheshimiwa Amos Nyaribo, gavana wa Nyamira. Wakiongozwa sana na gavana ambaye ni host, Governor James Elvis Omariba Ongwae. Tunazidi kuwakaribisha. Feel welcome at Nyonsia. Feel welcome at Kisii University. DJ. uchungu na mateso, kwa vilio na huzuni. Umoja ni fahari yetu, undugu ndio nguvu. Chuki na ukabila hatutaki hata kamwe. Lazima tuungane, tuijenge nchi yetu. Pasiwe hata mmoja anayetenganisha. Naishi na tumaini, najitolea daima Kenya. Hakika ya bendera ni uthabiti wangu. Nyeusi ya wananchi na nyekundu ni ya damu. Kijani ni ya ardhi, nyeupe ya amani. Daima mimi Mkenya, mwananchi mzalendo. Kwa uchungu na mateso, kwa vilio na huzuni, tulinyakuliwa uhuru na mashujaa wa zamani. Hawakushtushwa na risasi au kufungwa gerezani. Nia yao ukombozi, kuvunja pingu za ukoloni. Naishi na tumaini, najitolea daima Kenya. Hakika ya bendera ni uthabiti wangu. Nyeusi ya wananchi na nyekundu ni ya damu. Kijani ni ya ardhi, nyeupe ya amani. Daima mimi Mkenya, mwananchi mzalendo. Wajibu wetu ni kuishi kwa upendo, kutoka ziwa mpaka pwani, kaskazini na kusini.
Na hii Kenya tumeijenga kwa muda mrefu.
Umoja ni fahari yetu, undugu ndio nguvu. Chuki na ukabila hatutaki hata kamwe. Lazima tuungane, tuijenge nchi yetu. Pasiwe hata mmoja anayetenganisha. Naishi na tumaini, najitolea daima Kenya. Hakika ya bendera ni uthabiti wangu. Nyeusi ya wananchi na nyekundu ni ya damu. Kijani ni ya ardhi, nyeupe ya amani. Daima mimi Mkenya, mwananchi mzalendo. uchungu na mateso, kwa vilio na huzuni, tulinyakuliwa uhuru na mashujaa wa zamani. Hawakushtushwa na risasi au kufungwa gerezani, nia yao ukombozi, kuvunja pingu za ukoloni. Naishi na tumaini, najitolea daima Kenya, hakika ya bendera ni uthabiti wangu, nyeusi ya wananchi na nyekundu ni ya damu, kijani ni ya ardhi, nyeupe ya amani. Daima mimi Mkenya, mwananchi mzalendo. Wajibu wetu ni kuishi kwa upendo, kutoka ziwa mpaka pwani, kaskazini na kusini.
Na hii Kenya tumeijenga kwa muda mrefu. Kwa nini tunataka kujaribu ni one day?
Naishi na tumaini, najitolea daima Kenya, hakika ya bendera ni uthabiti wangu, nyeusi ya wananchi na nyekundu ni ya damu, kijani ni ya ardhi, nyeupe ya amani.
DJ, thank you. Let's appreciate 1 minute my band. 1 minute my band. Let's appreciate excellence for Homa Bay County. Please let's be standing. Tumkaribishe tu kwa kusimama kwa heshima yake Excellence Awiti, Governor Homa Bay County. Karibu nyumbani. Welcome sir. Thank you. Please be seated. Asanteni sana. Band. Basi kwa heshima nitawaomba tuweze kuwa tayari kabisa, tusimame tumkaribishe, tuweze kuwakaribisha wageni wetu. Basi naomba tusimame wote kwa heshima ya wageni wetu wakiongozwa. Be standing all of us. Karibu sana. Welcome your excellence. Welcome sir. Excellence is present. Karibuni sana. The UK delegation feel most welcome. Thank you so much our principal secretaries. Asanteni sana. Let's find time. Thank you so much the UK High Commissioner. Thank you. Thank you. Thank you for coming. Let's find our place and be comfortable. Tuwakaribisheni tafadhali kwa makofi 1, 2, 3. Tena. Tena. Asante. Asante sana. Karibuni. Excellence, our Governor of Kisii ameandamana kwa karibu sana na mwenyekiti wa Lake Region Economic Block, Governor wa Kakamega, Mheshimiwa Wycliffe Ambesaparanya. Yuko pia kwa karibu sana hapo na Mheshimiwa Governor wa Siaya, Mheshimiwa Colonel Rasanga. Kwa karibu pia ni jirani wetu, jirani mwema zaidi, Governor wa Homa Bay County, Mheshimiwa Cyprian Awiti, na jirani wetu Mwanu Nkagaiga, Excellence Amos Nyaribo. Together with us also is the UK delegation. Please be stand up as we receive and sing the national anthem of Kenya, followed by the East African anthem, then the UK national anthem. Tafadhali ikiwa umevalia kofia isiyo rasmi, unaomba kwa heshima ya taifa yetu uweze kufia kofia yako. DJ Kisii University Band, tuongoze kwa wimbo wa taifa wa Jamhuri yetu ya Kenya. The East African anthem, band.
African anthem.
And the last one, the UK national anthem. Please remain standing. Thank you.
Anthem.
Let's remain standing for 1 minute kindly as I usher in the University Chaplain to lead us in a prayer. Welcome.
God the Father, the Son, and the Holy Spirit. We thank and praise you, Lord, for our visitors who have come here today. As we gather here, Lord, we ask for your heavenly blessings. We thank you, Lord, for this great gathering here at Nyosia for the launch of the Center of Excellency in the Health Education and Training. We thank you for the great minds that were behind this project, Lord. You have created people in your image and likeness and endowed them with the wisdom and knowledge that now we want to celebrate and thank you and pray that you bless each one of them here. We thank you for our government of Kenya for having accepted this great project to be put here. We thank you for our governors who are here from various counties, especially the Red region. We ask that you bless them, Lord. Bless also here our government officials that are here, our politicians that are here. We thank you for our great university, Kisii University, the council members, the vice chancellor, and the team of management. We thank you, Lord, for all our partners. And we thank you more especially for the Kenya-UK Alliance that has also participated in this and also take part. We thank you, Lord, for all our leaders. We thank and praise you. And we pray that you may bless this event, Lord. You bless this site of Nyosia, where we are going to have this great center of education and learning. Good and loving Father, we ask for your blessings upon all those who have gathered here today, and even those who are going to be beneficiaries, as we see that this project be completed 2045. We also ask you to bless those who are going to put up these buildings, that may be guided by your wisdom. We ask, Lord, that you may lead us this day, guide us in all the activities that we are on to carry out, and we make our prayer in the name of Jesus Christ, our Lord, the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Thank you very much. Kindly, let's be seated. Excellence, the host governor of Kisii, Governor James Ongwae, the head of delegation from UK, His Excellence, Governor of Kakamega, who is also the chair of Lake Region Economic Bloc, Mheshimiwa Wycliffe Oparanya, Excellence, Governor of Siaya, Excellence Colonel Sanga, the Excellence, Governor of Homa Bay, Mheshimiwa Cyprian Awiti, the Excellence, Governor of Nyamira, Mheshimiwa Amos Nyaribo, the Vice Chancellor of Kisii University, Professor Kama, the Chair of the Council, Dr. Mundanyi, the representative of our PSS present, all protocols observed, ladies and gentlemen, good afternoon. God is good. Say hi to us. If you are seeing me here, raise up your hand. Thank you very much. We welcome you to Kisii County, and specifically to this land of Kisii University, for this wonderful occasion of the signing and launch of the Center of Excellence in Health Education and Training at this land, Nyosia. You are in Kiumbu Ward, Kisii County. Welcome. Allow me, Your Excellencies, to welcome my co-hosts, Dr. Rose, to give us a bit of entertainment. Feel most welcome, and thank you.
Thank you, my co-MC Oseko. Allow me to do that correction. I'm Dr. Osoro Gladys, not Grace, but they are closely related. Thank you so much. Can we give a round of applause to the university band for leading us through the first part of our welcoming and singing the anthems. A round of applause, a good one. It is sunny out here. Thank you so much. Thank you. At this time, allow me to bring in the Kisii University choir to give us 2 items of entertainment. Then they will be followed immediately by the Obokano, and traditional dances. Feel free, relax, and enjoy yourselves as we receive this entertainment. Please come up stage. It will be better up here.
Thank you very much. We shall give you 2 items. Welcome.
Kenya kipenzi, nchi yetu ya amani. Kenya kipenzi, nchi yetu ya amani. Nchi yetu tunasonga mbele. Nchi yetu amani twaipenda. Tunasonga mbele. Nchi yetu ya amani twaipenda. Mungu Mwenyezi ametulinda siku zote. Mungu Mwenyezi ametulinda siku zote. Siku zote ametulinda, ametulinda, ametulinda. Siku zote ametulinda, ametulinda, ametulinda. Siku zote Mungu Mwenyezi ametulinda siku zote. Siku zote Mungu Mwenyezi ametulinda siku zote. Siku zote ametulinda, ametulinda, ametulinda. Siku zote ametulinda, ametulinda, ametulinda. Siku zote wageni wetu karibuni chuo chetu. Siku zote wageni wote karibuni chuo chetu. Siku zote karibuni, siku zote chuo chetu kinang'ara. Karibuni, siku zote chuo chetu kinang'ara. Kenya kipenzi, nchi yetu ya amani. Nchi yetu Kenya kipenzi, nchi yetu ya amani. Nchi yetu tunasonga mbele. Nchi yetu ya amani twaipenda. Tunasonga mbele. Nchi yetu ya amani twaipenda. Kiongozi wote karibuni chuo chetu. Siku zote viongozi wetu raha tele kuwaona. Raha tele tunashukuru viongozi, tunasema asante kwa kufika. Tunashukuru viongozi, tunasema asante kwa kufika. Tunashukuru viongozi, tunasema asante kwa kufika.
Kisii folk song for entertainment. Welcome.
ngawa iseke mbageti mbageti Tirongero gangonga baba tirongero gango gangonga baba tirongero gangonga baba ngantira mwato motenga baba tira mwata makere tira maikaranzanga baba tira mwato motenga baba tira mwata makere tira maikaranzanga baba muzikene kene kebariri muzikene kene kebariri ena itorache obe baba ngaitorache obe baba ngaitorache baba bya baya bagaje seito baba bya baya bagaje seito ongwayo mindo bagaje seito ongwayo muyo bagaje seito boranyo mugambi ogambe seito deri bo babo bagaje seito yara muyebeseke bange ngirani kuma kubasoka mabere tuanyora genda roche nyama itone genda roche nyama itone genda roche obuchama ya amakeno noku obuchama ya amakeno noku Wonderful Kisii University choir. As they are coming in, allow me to say that they have given us 2 items. The first item was saying that Kisii, Kenya is a land of peace, and you are welcome. Our guests feel at home, and we are purposed to maintain this peace. The second piece, the traditional one, is telling us that academics is like a hill. So you really have to struggle, work hard, and climb that particular hill. And that resources are scarce. So you have to strategically work so that you mobilize them for your development. Can we appreciate them as we welcome the Kisii traditional dances? Welcome, Kisii traditional dancers. The stage is yours.
Jambo Kenya, habari gani? Mzuri sana. Wageni mwakaribishwa hapa Kisii, hatuna matata. His Excellency Gavana Ongwae amewakaribisha, karibu nyumbani. Gavana wa Lake Region, welcome, feel at home. Wazungu, you are welcome, feel at home. Yenseyo Ongwae, welcome. All visitors hapa kwetu, we have no problem. Excellence Gavana Ongwae amesema all welcome Kenya nchi yetu hatuna matata. Kenya ya amani hakuna matata. Welcome all officers, hakuna matata. In first Kisii County, hakuna matata. Because you have come, hakuna matata. Kuja mukule mataoke, hakuna matata. Ungwae, ungwae, tabano ungwae, marare. Umugaba nungwae, kwaratira basongo. Umugaba nungwae, you have brought visitors from abroad. You are welcome. Akibana ngobugae, ungwae minto waito. Umusacho yotenenire, sibiri ya witu. Obaranya wicho, kono jemu yare, waito. Obaranya welcome. Stand up and dance. It's more repeat. Obaranya waito. Isa kisarenze awiti. Awiti welcome. Isa ya matoke. Hera sanga. Kamutisi way. Hera sanga. Kamutati way. Hera sanga. Kamutati way. Kama nungwae kam. Kama nungwae kam. Kama nungwae waito. Kono jembi ya more beni ombeni. Chukuche hero bilo. Hero bilo. Beni wayo ngwae no. Ngwae welcome. Do jembi yare. Eita kama burowe sanga yore. Vice chancellor. Wakori la mayanga ombeni ombeni ombeni. Chukuche hero bilo. Hero bilo. Beni waya. Hendo jembi yare. Yeto kende gorego. Ikondo jembi yare. Ndo jeba nombi yare. Beni ombeni. Chukuche hero bilo. Hero bilo. Otelo lire waito. Do jembi yare. Vice chancellor. Kisii University. Center of Excellence. Nakiba noko kora. Because of the time of songa ubono wako bunjeji dora.
Welcome, welcome. Thank you so much. This is awesome. This is awesome. Kisii County dancers, welcome. Yes, they have told us, as I'm doing this, Mombinya, kindly, you should be on stage. They are telling us that Kisii is a place of peace. In Kenya, we have no problems. You are doing your investment in the right place. They are saying Governor Ongwae, together with the Vice Chancellor, Kisii University, have maintained a cordial relationship, and your resources are in the right hands. Thank you, Mombinya.
Okay, my DJ 20 cast. Stand up, no good to the sound of the stand up, no good to the like I was saying, Goraba, Brabani, like you were saying, Goraba, Satababa, like you were saying, Goraba, Getibani, like you were saying, Goraba, Satababa, Babaito. I think you get quite in to tell you what the boss and the thing to have and the two colleagues. I don't want to be I didn't see you.
Thank you so much, my DJ. Thank you. Check. Wapigeni makofi tafadhali. A round of applause to this wonderful, wonderful groups of entertainment. Yeah, thank you very much. Thank you very, very much. Advancedly, we made a mistake. We never recognized the Deputy Governor for Kisumu, Dr. Matthews Owil, representing the Governor of Kisumu, Professor Anyang' Nyong'o. Welcome and welcome to Kisii. Without much ado, Your Excellencies, our chief guest, allow me welcome Dr. Unchari Kenani, who is the head of Secretariat KUHA, to give us an overview of the Kenya-UK Health Alliance project and visit. Dr. Kenani, as he comes, allow me 1 minute. Kisii University Band, in 1 minute as we welcome Dr. Kenani. You give us a piece from Thank you very much. We also recognize Dr. Jared Nyakiba, who is representing Principal Secretary, Ministry of Health. Thank you so much and welcome. Dr. Unchari Kenani, please. Okay. 1 minute.
Excellencies, governors, our guests from the UK, and all protocols observed. Being cognizant of the program before us, I'm going to be very brief. On behalf of the KUHA Kisii Chapter Secretariat, I wish to welcome you all to this function. I have been tasked to give a very short brief on the Alliance. I believe that the 21st century development paradigm has now embraced a concept that we cannot realize sustained development while leaving others lagging behind. This has been amplified more by the COVID-19 pandemic, where we realize that the so-called boundaries which we know, some of these things don't know them. We are one interrelated global family, and we have to develop together. The Kenya-UK Health Alliance, which goes by the name KUHA, is premised on this understanding KUKA is a mutual agreement between Kenya and the United Kingdom for health workforce collaboration that provides for bilateral knowledge exchange and capacity improvement. Both countries seek to benefit from each other's experiences and comparative strengths in healthcare. The MOU was signed in 2021 by the University of Manchester, the Vice President, Professor Graham Lord, who is here with us, Dr. Richard Cowan of the Christie Hospital, John Wareng of the University of Manchester Foundation Trust, and Kenya's High Commission to the UK, His Excellency Manoa Isipisu, on behalf of the Kenya government. Since the commencement of this collaboration and partnership, we have witnessed a few activities, and I will highlight a few of these. Firstly was a research grant that we received to carry out a study that targeted 3 informal sectors in Kenya, in Nairobi, Nakuru, and here in Kisii County, to find out the effectiveness of masks in halting the spread of COVID-19. The second has been the sending of nurses to work in the UK, with the first batch that went there in December last year, and I'm sure there are more in the pipeline. The third is the setting up of an oncology center of excellence at the Kenyatta University Teaching, Referral and Research Hospital, and we'll be hearing more about that later on. And now, where we are today is a center of excellence in healthcare training, Kisii University, which is being launched today. So as you can see, the alliance has started working. I wish to sincerely thank His Excellency Governor Ongwae for being magnanimous enough that when he was informed of opportunities that existed through collaboration and partnership with the UK, he decided to bring that to the attention of the national government so that Kenya as a country would benefit from this partnership, and not only Kisii County. Equally in the same spirit, we wish to thank Madam PS Susan Muchache for also agreeing to travel twice to the UK to carry forward this discussion and firmed up the partnership whose fruits we are seeing today. I'm privileged to have been appointed as chair of the Kisii KUKA chapter, the hub for the Center of Excellence in Healthcare Training. At this juncture, I wish to request members of the Kisii KUKA chapter to please stand so that you can be recognized. And these are the members whom you are going to approach during this particular sitting up to the evening to assist you in any of the issues that may arise related to this exercise. If you could just wave where you are. These members are drawn from both the county and Kisii University. May I, please, could you please sit? Thank you. These members will be at your disposal, as I said, throughout this program. Kindly note where they are seated. I wish to urge the spokes also to urgently send us names of their representatives so that we can sit together and develop an institutional framework of engagement. And the spokes in this case refer to mean Kisii being the hub. We have Maseno University, we have Egerton University, and we have Masinde Muliro. If we could receive these names by Thursday, 24th of March, then we could start developing our plans for approval by the steering committee that comprises governors and vice chancellors of participating counties and universities. Kindly submit your names through the CEO, Lake Region Economic Bloc. And at this juncture, I also wish to request members of the Secretariat of the Lake Region Economic Bloc who have been working with us to prepare this program to also stand and be recognized. Thank you very much. I want to affirm I am informed that Egerton and Masinde Muliro are here. Why don't members of the spokes please also stand so that we can recognize you? Members from the spokes, Masinde Muliro, Egerton, and no, the vice chancellors will be introduced by somebody else, not me. Thank you. I want to assure you that we are ready for action and raring to go. Thank you for giving me this opportunity to address this honorable gathering.
Thank you so much, Dr. Kenani, for that brief. At this point in time, I'd like to invite Professor John Akama, the Vice Chancellor, Kisii University, to give his remarks and advisory, and welcome the other members of the advisory team to give their remarks. Professor, can we appreciate him as he comes to the podium?
Thank you very much, MC. Professor Graham Lord, the Vice President of the University of Manchester, and the whole team from the UK who are with us here, representatives of the Ministry of Education, represented here by Mr. Clement Odeka, representative from the Ministry of Health, represented here by Dr. Nyakiba, the chairperson of Kisii University Council, the chairman of KU Kenyatta University Teaching and Referral Hospital Board, Professor Mugenda, Professor Emeritus, former Vice Chancellor of JKUAT, Professor Atemo Micheka, Your Excellencies, the governors who are with us here, we appreciate you so much. Most of you are part of the Lake Region Economic Blog, read by the host, His Excellency Governor James Ongwae, the chairman and the governor of Kakamega County, His Excellency Dr. Wycliffe Oparanya, the governor of Siaya County, His Excellency Rasanga, the governor of Homa Bay, Awiti, the governor of Nyamira, Amos Nyaribo, my dear vice chancellors who are with us here, the vice chancellor of Egerton University, Professor Isaac Kiwage, the vice chancellor of Masinde Muliro University of Science and Technology, Professor Solomon Sibairo, the chair, the members of the secretariat and the technical committee. We also recognize our Kisii University students, the Scouts movement, who have been giving us here in the anthems and other entertainments, the Kisii University Choir, and also students from the School of Health, mainly from the students who are doing a degree in Bachelor of Medicine and Bachelor of Surgery. Maybe can you stand? They are critical stakeholders. Wherever you are, can you stand? Yeah, those are the students who are being trained doing a degree in Bachelor of Medicine and Bachelor of Surgery. And we are made to understand that you are doing a very good job. By the way, Kisii University was launched in 2019. Kisii University School of Medicine was launched as number 3 of all the schools of medicine in our country by the East Africa Medical and Inspection Board, which is not, achievement. And of course, the chairman of the student union is with us here, Kisii University. I also join the previous speakers to say good afternoon. Good afternoon again. Let me take this early opportunity to welcome all of you to Kisii University Nyosia Farm. And we have got to acknowledge that today we are standing on a special ground, and your excellencies and our distinguished visitors, this land was donated by the senior chief Nyandusi, who was a senior chief when the country was under the British administration. He donated this 70 acres of land to the then Kisii County Council, specifically with the clear instruction that this land be developed into a medical facility. And now we are here, and we are actualizing that vision of this famous chief more than 50 years ago. The land was later given to Kisii University. Where we are is a 70-acre piece of land that will house our collective vision and the overall project. Today we are making a major milestone, and let me take this chance to appreciate all of you for being part of this great venture. Ladies and gentlemen, we have got to acknowledge that we now have an excellent opportunity to assist achieve one of the national government 4 pillars of our president, the pillar on universal health care. In particular, we have a unique opportunity of bringing together 4 institutions of higher learning, pulling their resources together for a common good. These are Egerton University, Maseno University, Masinde Mulilo University of Science and Technology, and of course, Kisii University. More so, we are going to partner with renowned University of Manchester and Kisii Hospital, one of the top, training hospitals in health in the world, from the United Kingdom, in this noble undertaking. Kindly, our visitors from the UK accept our gratitude for partnering with us in this great initiative. Since being elevated to a university, Kisii University has expanded exponentially in terms of academic programs, in terms of research outputs, in terms of extension services, student enrollment, and staff establishment. We have got to say that our university is relatively young compared with the University of Manchester, which is almost 200 years old. This university, we are just around 12 years old. So here is an old man and a young man or a baby coming together for a common cause. This institution started way back in the 1963 as a primary school teachers training college, and later it was upgraded by the government into a campus of Egerton University in 1994, And then finally, in the year 2007, Kisii University College was established as a constituent college of Eastern University. And eventually, we got our charter in the 6th of February, 2013. I have got to say that we have really grown relatively, at a high level. And currently, we have got more than 20,000 students. We have to note that all of us have come from diverse backgrounds with unique perspectives to help facilitate the success of this landmark program. The Center of Excellence for Healthcare Education and Training program will improve the quality and availability of healthcare services, training, research, and innovation in the whole of this Western Kenya region. And by extension, we have got to say that if it continues growing, it will also provide services to the East African region, and indeed, probably, God willing, the whole of Africa and the world at large. Consequently, this place where we are here today is earmarked for this very great project. We have got an ambition, and sometimes it is important to have an ambition to think big. We are thinking of this place to develop into a medical campus or a medical city, providing services in health and other related fields. And we have seen it in the designs that we have already presented outside there. As already indicated, several institutions are strategically aligning themselves to promote and benefit from this program. We wouldn't have chosen a better pillar to partner under. Health is the most precious thing you can ever be given. Perhaps most of us have experienced through our families and friends how different health crises have brought down and bankrupted many people. It is impossible to put a price on the value of good health systems, including well-trained medical personnel. My distinguished guests, ladies and gentlemen, and all the protocols observed, we have got to comment that currently Kenya has got 12 doctors for every 100,000 people, which is far below the World Health Organization recommendation of 36 doctors for every 100,000 people. And in this regard, as a country, we need to do better. The Center of Excellence in Healthcare Education and Training will help us balance this equation in terms of the training of the requisite high-quality human resource. The above statistics are worrying, and it is our responsibility to help provide a better future for our people. If I may quote the former president of the USA, Barack Obama, he once said, and I quote, "We did not inherit this heart from our parents, but rather borrowed it from our children. We need to return it to them better than it was when we borrowed it." In this regard, we have to gear up to bequeath the present and the future generations with adequate and well-trained medical personnel, facilities, and services. Coming to the end of my speech, I want to say that the launch of this Center of Excellence today is the beginning of a remarkable journey and a wonderful partnership of institutions of higher learning from Kenya and the UK with a common goal of developing a Center of Excellence in health care personnel training, research, and innovation. It will be the nexus of change for many people in this region and beyond. It will also provide a chance for a better life to hundreds and thousands of people from near and far. To quite simply put it, it will positively transform our society. Our next step should be practical and strategic. We should think about the future that is to come as we make decisions in the present. Apart from the training of high-level health personnel, this project also provides a window into the broad opportunity of vaccine and pharmaceutical production in the region, to provide sustainable supply of health products and technologies, not only in Kenya, but also in the whole of the sub-Saharan region. Our commitment and resolve to push for the success of this program, even in the face of enormous challenges, should be unwavering. I call upon all of you to join us with such a firm figure and tenacity, for that is the only way we will guarantee our success. With those remarks, I say a very big thank you, and may God bless our visitors, our governors, our vice chancellors, and other partners. And we are very excited for this arrangement today. Thank you very much for giving me the opportunity to address you. And from here now, we are going to continue briefly with the other vice chancellors who form, Kisii University, as you have heard, will be the hub of this Center of Excellence. In that hub, we have got 3 spokes, which is Egerton University, Masinde Mulilo University of Science and Technology, and Maseno University. These universities, they will work closely in terms of coming up with strategies, coming up with curricula and pedagogy to train high-level medical personnel to serve our country and beyond. And we have got to realize that this is a noble duty when we look at the number of doctors which we have in our country. So, ladies and gentlemen, I have got to remind you once more again that this is a very historical moment. And I will challenge the major stakeholders who are with us here from the UK and Kenya. Please, we humbly, as much as we look to be a very young system, we humbly request you to work with us, particularly in sourcing for resources to start this project. The big elephant in the room is getting the requisite resources. But I know that if our big brothers are willing, we'll get there. So that is our humble request we are making. And if we do that, we are doing God's work. This region where I'm talking about of Western Kenya, which is forms more than 20 counties, more than 20 million people, is poorly served with medical facilities and also with high level. In fact, this will be the only one of its kind in terms of having a center of excellence in the area of healthcare personnel training. Now, I will request at this juncture, we do have with us people who are going to be very key. We have got Professor Ratemo Micheka, who will provide advisory services to the committee spearheading this project. I don't know whether you have got the word to say.
My name is Professor Micheka. Really, on behalf of the Advisory Services Committee, I stand here really to say, special guests from the UK, our governors, your excellencies, personnel from the ministries of education and health, students who have performed very well. You've done well on the East African Anthem, plus others. I stand here really to say that we have a committee of 4. Professor Kibwage, Professor Ramakama, who is not here today, apologies, Rogo. Then Kakamega, we expect somebody to join us. Sarah Umache, who really will be seeing the technical part of this undertaking all through. Professor Mugenda will be talking to us, one of the advisories, and I'm so happy that I associated with the KU, a similar venture we shall actually take. With those very many remarks, and you have done well to really explain, may I thank you all for coming and wish you the health. Governors, thank you for the support. The Lake Region Economic Bloc, you have done well. Professor Logo, please just come. Where are you? I want to see you so that they don't just stand here and then I won't allow you to talk. And the Kibwage stand here. Susan, these gentlemen will be the ones advising the, please, Karibu. Susan, where are you? Susan is not there. Kibwage. Sarah Omache, she should have been here. Probably somewhere she's coming, but I just thought I would introduce them to you. In case anything goes wrong, this gentleman and lady will be the ones responsible for any damage. You can't see them, yeah. Yeah. Mask na you. These are the persons we shall drive this actual undertaking together. My pleasure to see them, and from here, brother, let us drive this machine to the best of letter. Oh, you want to say your names? Let's just say your names then, please. Yeah. Just your names. Okay. Yeah.
Thank you. My name is Sarah Omache, and I'm the CCM, or Minister for Health for Kisii County Government. Thank you.
Isaac Kibwage, Vice Chancellor, Egerton University. Good afternoon. My name is Kama Rogo. I come from Siaya County, so my governor is here. I am a retired but not tired global health expert. It's a pleasure to be asked to be in advisory committee of an institution that is pursuing excellence in health. Thank you.
Thank you very much. We expect now one more from Kakamega, and we shall actually form a team, a formidable team. Thank you so much, bro, for this opportunity. I thank you all.
Can we give a round of applause to the Professor Micheka for those distinguished remarks? We do have Professor Olive Mugenda, who is the chair. Is it, we call it chairperson or chairman? Which one do you prefer? Chairperson, the Kenyatta University Teaching and Referral Hospital Board. Make us a brief remark, and we continue that way. Thank you. Welcome, Prof.
Your Excellency, the Governor of Kisii, Honorable Ogwaye, other honorable governors, our guests from the UK, led by the Vice President, Professor Lord, Vice Chancellors, Chairperson of the Chairperson of the Kisii University Board, Professor Micheka, my good friend, and Professor Micheka was my chairman of council when I was VC for quite a few years in KU, and all esteemed guests. I'll just be very brief. I'm very happy to be here among you, and particularly university community. You know, I left KU, so I miss university community. So I'm happy to be here. Thank you very much, Your Excellency Governor Ogwaye, for the good work you're doing here in Kisii County regarding cancer care. And we acknowledge your efforts in 2019 when you visited the University of Manchester and helped start all this program. KU University, where I'm the chairman of the board, is looking forward to partner and work with the Kisii County to offer a whole continuum of cancer care through screening, diagnosis, treatment, and palliative care of patients in this country. The Kenyatta University Hospital and University of Manchester yesterday announced the establishment of a similar center, but this time Center of Excellence in Cancer Care Research and Training, which will be the research hub, and we will work with the same model of spokes. And we have 5 counties that are going to work with us, and other stakeholders. We are also launching, again, in collaboration with Manchester, University of Manchester, we are also launching soon the Breast Cancer Center of Excellence. We feel that we need this regional breast cancer excellence, because again, breast cancer is very prevalent. The Center of Excellence in Cancer Care and Research and Training at KU Hospital will look at understanding the causes of cancer, the risk factors involved, develop therapies appropriate to the local population, and effectiveness of this treatment through clinical trials. We also focus on precision medicine and evidence-based practices. We also plan to have Africa genomic database. Rob, this is your area. Again, with support from Manchester. We use research outcomes to inform treatment, to improve health outcomes and survival for Kenyans. As an activity of this center, yesterday, again, in collaboration with the University of Manchester, we announced a joint grant, I think it's covered today in the dairies, of about 446 million for the study of cancer. We want to study the cancer of the throat, find out why it is prevalent. So I'm happy to work with you. In this particular grant, we are working with Kisii as a hub, also Meru, Garissa, Nakuru, and Nyeri, so that we establish the causes of this disease and what we can do to prevent it. Lastly, Professor, if you can allow me, let me announce also that at KU Hospital, we have the PET scan machines that are not in East Africa and not in Central Africa. The PET scan machines is a machine that is able to detect cancer very, very early. And a lot of us are going to India for that service. So please pass the word. You don't have to go to India. We have the PET scan machines, we have the SPECT-CT machines, and God bless you all.
Can we give a better round of applause to the chairman, a very dynamic lady in our country, and we do appreciate our presence with us here. We really appreciate that, and we also appreciate that she can also assist us in terms of pushing forward the idea of getting resources for this Center of Excellence for healthcare training personnel. Now, I will request the Vice Chancellor of Egerton University to come and make 1 or 2 remarks. My brother, Professor Isaac Kibwage.
Your Excellencies, the governor from the Lake region, Graham Lord, the University of Manchester team lead, and the visitors from University of Manchester, the Vice Chancellors who are present here, the Vice Chancellor Emeritus, distinguished guests, ladies and gentlemen, all protocols observed. I just want to make 2 or 3 remarks. One, I'm honored to be here and be part of this historic occasion where eventually Kisii will be hosting a Center of Excellence in training of healthcare workers. On behalf of Egerton, I thank the Kuka team here locally and from Manchester for agreeing to have us as a spoke. The spoke in Egerton will be based in Nakuru with Egerton University, partnering with the Nakuru County to develop a center of excellence in respiratory diseases. And when I look at the way we have forgotten about masks. Air quality continues to deteriorate. So it will be a center that will be really of importance to the country in the future. I normally say that health is the most important and a critical need for a human being. Once you are healthy, you can do anything else and move on. So training of healthcare workers is the serious contribution towards having a healthy human being. It is my hope that this alliance, the Center of Excellence we are thinking about, the node, the spokes, that all will be realized in the near future. Ladies and gentlemen, I have worked about this node and spoke in the background over a couple of years. So that's why I only say most of it has been dealt with by my colleague, the Vice Chancellor of Kisii University. I don't have to repeat, but I wish you all good health, and may God bless you.
Thank you very much, Vice Chancellor. Professor Isaac Kibwage, for many years, he was the principal of the College of Medicine, University of Nairobi, for more than 10 years. Can we give a better round of applause to Professor Kibwage? Thank you very much, Prof. Now we request the Vice Chancellor of Masinde Mulilo University of Science and Technology, Professor Sibairo, to come here and make a few remarks. Welcome, Prof.
Professor Graham Lord from the UK, team lead for the UK team, the Government of Kenya representatives at all levels, Your Excellencies, the governors of Kisumu, Nyamira, Kisii, and special recognition to the Excellency Governor Ngwe, whom I've known through his family, greet them. And my governor, Wycliffe Ambetsa Paranya, my fellow colleagues, including Ratemo Micheka, who employed me, and Olive Mogenda may have forgotten me, but we used to be in the Vice Chancellor's Committee times. The university communities, distinguished guests, ladies and gentlemen, if I'm right here, good afternoon. Mine is to say only a few things. One, I want to again reiterate what my fellow colleague, Vice Chancellor, said, that we too are grateful to be enjoined in this big project. Thankful to the Manchester University and Kisii University for considering us as a spoke. Two, the Masinde Mulilo University of Science and Technology is quite young, just 2 years older than Kisii University. I was talking to one team lead member from, the one who has just come from UK. And I told him I was trained in the University of British Columbia in Canada. I stayed there for 4.5 years. And he told me what a great university that was. And then he challenged me, will Masinde Muliro University be there? I said, yes. We are only 15 years. And those guys are over 200 years. And what you have done in 15 years is approximately maybe 5% or 10%. If you do good mathematics, you realize we take fewer years and we'll be there. And we have begun. So we may not be exactly like Manchester, but we have begun. We have made the first step. Like the Chinese say, a journey of 100 miles beginning with the first step. So thank you, that's where we are. Through him, our medical school is also quite very young. In fact, we are in the 4th year. You as probably, I don't know whether you have graduated. Yes, we have not graduated our students. We are in the 4th year, but we already have big dreams. This school was brought about by a dream of stakeholders led by our Excellency, the Governor. He said that one of our flagship programs when the university was coming in needs to be health sciences. And that's where we went. So since that time, he has deployed resources, terms of money, and even land to ensure that the school goes on. And even now and then he asks me how we are doing. And we are working greatly. Now, a few things. Today's occasion in this place brings us together with our UK counterparts in academia and healthcare, the national and county governments in Kenya, to address our core mandate of serving humanity. Health gap is widening widely, and the Lake region of Kenya in particular has borne the brunt of high burden of disease for a long time, yet it is richly endowed with resources. Masinde Muliro University of Science and Technology, in partnership with the Lake Region Economic Bloc county governments, expresses its gratitude to His Excellency President Uhuru Kenyatta for his tireless efforts to secure better health in Kenya through the universal health coverage and the Big Four agenda for initiating the promising partnerships with our UK partners. Masinde Muliro University of Science and Technology, together with the county government, have set aside land. In particular, may I mention the 4 acres set aside by the county government for a regional oncology center, and 2 acres have been identified to establish a drug dependence treatment center. And Masinde Muliro University of Science and Technology, in partnership with the county government, and are investing in strengthening mental and community health issues and infectious diseases control as their priority niches in healthcare in West Kenya. And here we jointly invite the national government, investors, and partners to achieve this noble task. We look forward to our continued support and excellent partnership with the national government and county governments of the UK. Finally, gentlemen, I just want to also complete and say that we are developing, as you have heard from that brief, a center of excellence in community health and mental care. Statistics show that in this country, out of every 4 people, 1 has a mental issue. So if you are seated near people here, count 1, 2, 3, 4. 1 person has a mental issue. I don't know which one. Maybe the one who is smiling. But we are there to try to solve that issue. So thank you, sir. And thank you for everything.
Can we also give a better round of applause to Professor Sibairo? He has told us that 1 out of 4 people in the environment, they have got a mental issue. So we are here, we are about 200, so you can get the arithmetic. Now I will request the Vice Chancellor of Maseno University, Dr. Julius Nyabundi, send apologies that he's having, I think he's having a council meeting of the university. And I don't know whether there is anybody he sent here to represent him. The Vice Chancellor of Maseno University, do you want to make one remark? Just, we were saying earlier that sometimes it's very difficult to manage time in our part of the world. Already we have sought the time by almost half an hour. And I can see that the governor is, who's the chief MC here, is telling me that we need to do better. So since you are not the Vice Chancellor, just say a word. Just come over here, please. Sorry for that.
Good afternoon. Honorable members, the chair of the Lake Basin Region Bloc. Mine is just to pass the apologies of the Vice Chancellor. And I want to pass his commitment to this venture. He's here in spirit and we will send back our good words. Thank you.
Thank you very much for being brief. Can we give our sister a better round of applause, please? Yeah, we have finished with the Vice Chancellors, Your Excellency. And again, we have got to recognize Your Excellency and your fellow governors. They are the people who started this initiative. And we appreciate the kind of work you have done in all our counties in the Lake region, particularly in improving healthcare facilities. If we enhance issues of training of personnel at higher levels, then we could have moved a very big milestone. Now I will, with protocol and with all due respect, Your Excellency, let's allow the chairperson of Kisii University Council, who is a medic in our training with a master's in pediatrics, with a PhD in tropical medicine, and somebody who's involved in a lot of NGO assignments related to health. So can we give a round of our applause to the chair of council, Kisii University?
Professor Graham Lord, Vice President of the University of Manchester, together with the entire team from UK that we have already met, the senior government officials from the Ministry of Education and the Ministry of Health, all the governors present, Your Excellencies, the Governor for Kakamega County, Dr. Wycliffe Oparanya, Your Excellency, Governor Kisii County, James Songwae, Your Excellency, representing Kisumu County, the Governor for Kisumu County, Your Excellency, from Homa Bay County, and Your Excellency, Colonel Rasanga from Siaya County. That's my governor. I hope you recognize me. Yeah, and Vice Chancellors present from the various universities, those who have spoken and those who have not spoken, distinguished guests, and the mother of the friend of my daughter, Professor Olive Mugenda. Our daughters have been friends from high school days. I'm so happy to be here. Distinguished guests, ladies and gentlemen, good afternoon. I had the pleasure of meeting one of my former classmates, and I want to request her to just stand because I must acknowledge her presence. Dr. Brenda Makoha,
That is my classmate from medical school. I'm so happy that you're here. The Chief Officer of Health, Kakamega County, we're glad that you're here. So on behalf of Kisii University Council and the entire Kisii University family, I am pleased to welcome each and every one of you to Kisii University. Today is a great day for the people of Western Kenya and East African region, and should I say Africa as a whole. As it has been mentioned earlier, we are here to start off a journey establishing a game-changing project. And I remember Professor Graham mentioned that the journey, the longest journey, starts with the first step. And today we are making that first step to this game-changing project, a center of excellence for health education and training that will transform health sector and ensure healthy lives and promote well-being for all in line with universal health coverage as inspired by the Kenya Vision 2030. And I know this has been talked about a lot. I'm so glad I have Professor Kamarogo, my senior, my teacher in the house. Give it up to Professor Kamarogo. He's a great man. Right. So the center will also address transfer of skills of specialist healthcare workforce, training, and research. Our meeting today will actualize our president's request, His Excellency Uhuru Muigai Kenyatta, to the UK government to establish communities of clinicians, researchers, and trainees in UK and Kenya, who will address the changing healthcare needs of Kenya and the neighboring regions, who will carry out research on etiology of non-communicable diseases within East Africa, who will develop treatments that are appropriate to the local population and disease, who will train a resilient and flexible multi-professional healthcare workforce in Kenya, and who will establish a clinical service that ensures high quality healthcare across all countries with counties within Kenya. I had the privilege and honor of being trained for my PhD in Japan. And I liked the way that the professors literally sat down with us and walked that journey with us. It was a little different from the training that I had in my undergraduate, because in this place, we were very scared of our lecturers. If you saw your lecturer entering the lift, you walked. You could not enter the same lift. I'm not sure if that has changed. But when I trained in Japan, there was such cordial connection between students and their lecturers. And there was such great transfer of knowledge and skills in a cordial environment. My dream and my hope is that the center that we're establishing will be that will be a replica of the University of Manchester. My dream and my hope is that you will work with us. You'll not just launch and leave, but there'll be a partnership. There'll be a connection. There'll be a transfer of knowledge and skills as we walk this journey together until we become that you have become over 200 years. I hope that we can achieve it in less than maybe the next 20 years. That will be where you are as a center of excellence. I wish to thank the University of Manchester for accepting to partner with us and by allowing their programs in medicine, pharmacy, and nursing to be licensed for use in Kisii University, and by extension, support the development of similar programs at Maseno, Masinde Muliro, and Egerton universities through a hub and spoke model. Now, I want to make a little break here. When I trained in medical school, we moved directly from classroom to the patient. And I remember when I moved from classroom to touching the first patient, and I tried to do my first intravenous injection, my hand was there shaking until the patient looked at me and asked, "Are you a trainee or something?" The patient was scared because I was like literally coming from the book to the patient. I'm hopeful that the center that we are developing will include a bridge where you have like a skills lab, where after the classroom, you'll train with this kind of dummy or something that you can train in effectively before you get to the patient. That is my hope, that the transfer will therefore be very smooth. By the time you come from the skills lab, you are actually ready for the patient. And that is the center of excellence that I'm dreaming about that will be in this particular place. So the Christie Hospital is also key in this endeavor by providing opportunities of training to the educator fellows. Lastly, in the interest of time, I wish to call upon the Vice Chancellor of Kisii University, who is moderating this session, to take it up from here and welcome the host governor. Thank you. May God bless you.
Give a special round of applause to the Chair of Council. Your Excellency, we are not doing so badly with time, particularly from the Kenyan context, African context, where kind of half an hour, you know, behind schedule. So we are doing quite well with that. And I know you guys, you are our leaders, and I know you are going to even move faster. With that remark, I would like us to put our hands together to welcome our great governor of Kisii County, James Ongwae. His Excellency, the Governor of Kisii County, who has got a lot of connections in the UK and also in Kenya with all these governors who are here. You have promised us that you are going to do your level best to make sure that we are able to get funds for this university medical training hospital. We are very happy about that and we are very thankful. So we appreciate you, and it's your time now, Your Excellency, to take over the program and eventually invite the other excellencies. Thank you very much.
Thank you very much, my brother Vice Chancellor. Professor Graham Lord, the Vice President of the Great University of Manchester, who is also the Dean of the School of Medicine in that university, your colleagues that you've come with, all of you who are my friends. I can see Richard smiling, can see Robert smiling, I can see my brother here smiling, and all of you who have come with a great professor here with your Vice President. Your Excellency, Honorable Wycliffe, Dr. Wycliffe Ambessa Oparanya, the Governor of the great county of Kakamega, and also the Chair of the Lake Region Economic Bloc, and also the Chair Emeritus of the Council of Governors, the colleague governors from the Lake Region, Cornel Rasanga from Siaya, Cyprian Awiti from Homa Bay, my brother from across here, Amos Nyaribo from Nyamira, Dr. Matthew Willie, the Deputy Governor of Kisumu. The Governor of Kisumu is the chair in the Council of Governors of the health pillar, is actually out of the country. I suspect is in Rabat in a meeting, because we are going to have the Afro Cities Summit in the great city of Kisumu in May, and he has sent his deputy. Dr. Richard Elbach, the Deputy Head of Office at the Department for International Development in the British High Commission, our great professor, also Vice Chancellor Emeritus and Chair of the great hospital that has come up in Kenya and in East Africa, and I think in the Central African region, based on what I saw there yesterday, Professor Olive Mugenda, the chairperson of the board of directors of the Kenyatta University Teaching and Referral Hospital, Dr. Mildred Mudanyi, the chairperson of Kisii University Council, the vice chancellors, all of you who are here, the 3 or 4 of you who are here, thank you very much, including Professor Atemo Micheka. Professor Atemo Micheka looks a bit ancient, but he was my classmate. Distinguished guests, ladies and gentlemen, I stand here a very happy person as governor of Kisii County, and it gives me great pleasure to welcome all of you to this great county of Kisii, to this subnational government in the Republic of Kenya. For the visitors who have come here, we have 47 subnational governments, and this is one of them. All of them are populations ranging from around 1 million to 2 million. I think the governor here who has the highest population is the governor of Kakamega with 2 million. My population oscillates around 1.5 million people. Let me extend my welcome to this county of soapstone and bananas. Can't you clap for yourselves, you? Especially those of you who are coming from here in Kisii. And that reminds me that the representative of the Ministry of Health and the representatives of the Ministry of Education, please feel welcome. I do note that you are in the room. We've gathered here for the launch of the Center of Excellence in Health Education and Training in Kisii University. And today's launch is a long journey that we have traveled as a county and as a country, and especially in the Lake Region Economic Bloc. And I'm going to tell you in a few minutes why. My leader of majority, you are in the house, Mr. Ogugu, is the leader of majority in the Kisii County Assembly, and the chair of the Health Committee in the County Assembly, Honorable Ngeri, and all the other MCs, the deputy chair, I see him there, and all the other members of the County Assembly who are here, please salute. Thank you very much. I'd forgotten about you. This is a long journey for us, but it's also a journey as a country that we have embraced, especially in the broader context of the priorities of our president of this country, His Excellency Uhuru Muigai Kenyatta. We thank him sincerely, because those of you from Britain, you would not have been here if he hadn't been involved. And I'm going to tell this gathering why. Single-handedly under the health pillar that he has prioritized, ensured that this was done, and even in his journeys when he came to the UK, and I happened to be there, he did mention about this particular program that we're talking up here. The journey, especially for the medical school for Kisii University, started in the formative years of devolution, because when I was coming in about 9.5 years ago, I'm now in my sunset period, a few months to go. But when I came in, the university was about 2 or 3 years old. And we came together as leaders in the Lake region and agreed to develop and implement a joint growth and developmental strategy, which was leveraged on the competitiveness of our area and the comparative advantages that we have as individual counties. And we all realized that without economies of scale, you actually can't go very far. So the Lake Region Economic Bloc itself, and I'll leave this with my chair, you go into the details, but it was launched by His Excellency the President in April 2015 in Kisumu. We have about 10 areas that it covers. I will leave that to my chair to bring them out. We did have, under the Lake Region Economic Bloc, this county was charged with having the inaugural Lake Region Health Investment Conference. And we held that conference of all the places at Kisii University. That conference brought together all Kenyans, and matters health were discussed, not only for the Lake Region, but for the entire country. And probably, Prof, before the visitors go, we can give them a copy of the resolutions of that conference. That is where the germination of these ideas started to come through. So some time back, we discussed with the Vice Chancellor. He hadn't started the medical school. The university was in operation, but he didn't have a medical school. So we sat down with him. I got my officers, because since he didn't have a medical school, myself now, I had, when we came in, when we started the county, this county had only about 16 doctors. It didn't have any specialists, not a single specialist. But we now have close to 200 doctors. I have the highest number of, one of the highest numbers of specialists in this country. At the moment, I have about 45 of them in the various areas of medical specialization, and you will be able to be told that in the afternoon. About 67 of them that are doing their specializations in various universities, some in Kenya, some in Tanzania, and some in your own country. By the time that they come back, this county would be having over 100 medical specialists alone. In the area of oncology, which I'm going to talk about, we are not doing very well. I think there are about 2 or 3 of them who are doing studying on oncology, and I blame myself and the officers in the Ministry of Health, because we sort of allowed a supply-driven training. We should have actually allowed gone on the demand-driven training side, but that becomes difficult because officers want to choose the programs they want to go to. But I've now directed them that any future programs must be supply-driven so that we can be able to achieve the imperatives that we want as a county. So, gentlemen, ladies and gentlemen, the other issue I want to mention is that we then agreed with him that we start the medical school. We put together a team of my officers, and then I thought very hard. We realized that we had somebody who used to be the principal of the College of Health Sciences of the University of Nairobi, who comes from this region, called Professor Kibwage. Professor Kibwage, if you can stand, please. And for a second, allow us to give you COVID, if you can face them and remove your mask. And this man, the 2 of us, me and the Vice Chancellor here, appointed him the chair of the committee to develop, have a seat, please, to develop the curriculum for the university medical school. And of course, I don't know whether he customized the one for the University of Nairobi or he developed a new one, but they together, all of them, they developed this curriculum, which, working closely with him, we then discussed with the Kenya Medical Practitioners and Dentists Union board that came here and looked at Kisii Teaching and Referrals to their university. And the president himself came here and based on that inaugurated the medical school. That medical school is the one that he was telling you, the Vice Chancellor was telling you that the students were standing here, and you'll be able to see where they're being taught. So what we have here is subnational governments starting to make sense, where everybody used to go to Nairobi for treatment. Now we are telling them that they don't have to go to Nairobi. They don't have to, they can only go to Nairobi with very, very special cases. And those special cases, then they go to a hospital. That hospital, madam, the way I saw it, you need the best, you need to be treating the worst cases. Otherwise, you can't manage. In those cases that should be going to India are the ones that should be coming to you based on what you have. So after that, then I realized that we needed to improve capacity, because around the same time, I'd done a project proposal, a concept paper, which had been approved by the Kenya government. It had been sent to a number of embassies. One day I received a letter from the Arab Bank for International Development and from the Saudi government saying they were ready to give us the equivalent of Kenya shillings, 2.5 billion shillings, but only if the government of Kenya would underwrite that. And I thank His Excellency the President, because the necessary government approvals were given. We are putting up a center here. The advert for that cancer center has already gone out, and I think they are identifying the contractor. It was actually on a site as you came. As you go down, we probably somebody in your vehicle will be able to show you the site, because it's not very far from the road. I then realized that, okay, we're putting up these structures, but is a cancer center about buildings? It is not. It is about the human capacity to run that center, both in terms of the higher professionals and the support staff, whether it's paramedical staff or whatever support staff. And that's when I came to the UK. And Graham, I visited your hospital. As the Vice Chancellor of that hospital, you were kind to me, including all these professors who are here. I don't know, you may have heard that this is a governor. I don't know whether that's why you received me so well, but you received me well. When I came back here, I went to the ministry and told the ministry that we have a collaboration here, which we need to improve on. Because at that time, the discussions were indicating that there was a Kenya, there was a Uganda-UK Health Alliance, but there was no Kenya-UK Health Alliance. And I think those discussions started there. The ministry got involved. Susan Muchacha came to the UK, and the rest is history. So we are here. The thing that makes me very happy is that you didn't forget this person from Kisii County. Even in the memorandums of understanding that were being signed, you included Kisii County. Even though we had wanted the cancer center ourselves, you, our good sister, took it. We didn't mind. We got something. So Graham, I sincerely thank you. When I came there, I met very many people, and it's good to mention. Sometimes it's good to mention, because I met your people in Manchester. I met Sir Roger King of the International Hospital Group. I met Professor Sitwell of the Health Education England. I met Lord Nigel Crisp of the Parliamentary of Global Health. I met Honorable Jeremy Lefroy, who is, I suspect, actually the patron of Kuka. I met the Wellcome Trust, the British Medical Journal, and the United Kingdom Export Finance Group, whom I'll mention shortly after this on the financing, which the Vice Chancellor, you did mention here, because I will tell you what we discussed with them and what communication I've received from them so far. So when I came back, I briefed my good chairman here. This man, the governor for Kakamega, has been chairing me, chairing everything that we sit on, chairing the Council of Governors, chairing the Lake Region. So I came and briefed him together with the other governors, and they were extremely excited. Of course, they were asking me why Kisii. I told them, but it can only go to one place. But we can share these facilities. Even the vice chancellors who are here, please do understand that it can only go to one place. And that's why we have the hub and the spoke model, which we've been discussing here. So, Professor and your people here, you signed the KUKA That is the understanding between UK. Actually, it was you who signed together with Richard there, together with Chris Piosto, together with John of the University of Manchester Foundation Trust and the Kenya High Commission. If I'm not wrong, I think you're the ones who signed the MOU, the Kuka MOU in London. And we thank you for that, since you are leading the entire UK group in this. I also want to thank Kenyatta University for part on the matter of cancer, where they launched. We were there yesterday, and I spoke there yesterday, ma'am, and we are spoke there. Just like these others are spoke here, and you are the hub on those matters cancer, and we are spoke there. And this afternoon, after this meeting, there's we launching in Kisii store. We are launching with them the beginnings of cancer care in Kisii teaching and referral hospital, and that will be a good thing. This afternoon, we do happen to be killing two birds with one stone. The governor is here, and myself, if I have time. We have a meeting which is ongoing. The Lake Region Economic Bloc Summit meeting is ongoing as we speak. Our ministers are there. The governors are going for that meeting after this meeting, so that they can be told by their ministers the basic discussions. And I suspect that part of what they are going to be told is what is going on right now. That meeting is taking place at what we call the golf club. So, ladies and gentlemen, in this arrangement, where Kisii University is the hub, which is going to be there for the training of health workforce, I would want to leave that to Graham. Graham, you need to unbundle this training, because it is slightly more than the normal training that is being undertaken in universities, whether it's Maseno, Kisii, and so on. This training for health education, if you can unbundle it when you're going to talk to us. But the spokes will undertake the following. Maseno University will focus on malaria, HIV, and AIDS, and sickle cell disease. Masinde Muliro University of Science and Technology will focus on mental health, substance abuse, infectious diseases, and community health. And University will be focusing on respiratory diseases. That is what we've generally agreed, but it's not cast in stone. That is why we have two great minds here. We have Professor Atema Micheka, who was the founding, I think, Vice Chancellor of University of Science and Technology. I suspect you are the founding Vice Chancellor. I'm right, I'm always right. And that's what I keep on joking with you. And then we have Dr. Kamarogo. Kamarogo is a great man. This man who came here, the tall man, that's a real great man. These two are in the advisory committee advising the vice chancellors to ensure that this program actually succeeds. While attending the 26th UN Climate Change Conference in Glasgow, His Excellency, the President of this Republic, met with you. And I did happen to be there. I was in the sidelines of the UN conference. He met with you and your entire group. Most of you were here, and I also happened to be there. And a lot of agreements were made, including this meeting takes place. Based on that, our governor here, our chair of the Lake Region, called for a meeting in Kisumu, which we met about not even 3 weeks. It's about 2 or 3 weeks. We met there, all of us, the governor, sitting here together with all these vice chancellors, and we agreed on the broad coordinates of this, how the entire urban spoke model was going to work, and we signed an MOU. An MOU was signed between Kisii University, Maseno University, Egerton University, Sinde Muliro University. This event was witnessed by the host governors and the Principal Secretary for Health, Susan Muchachi, who was also in attendance. And we say that the spoke model is not rigid, that it would accept other universities from the region and even from Nairobi. And yesterday I did talk to you, Mama. I told you, I don't see why you can't also be a spoke in this particular region, in this particular argument. So that I think Professor Atomo Michieka and Dr. Kamarogo, if you, two of you think even for a minute that there's somebody behind you who's going to help you, or if the vice chancellors or Professor Kama, you think there's somebody behind who is going to help you people implement this, then you'll be very, very wrong, because there will be nobody behind. You must push this and push us as governors to ensure that it's properly implemented. So, ladies and gentlemen, and especially our brothers from the UK, we want to tell you that as a region, we have embraced this program, we have met, and we have agreed that you on health services is just like water. You can't deny anybody water. In my own institutions, I do not deny anybody. In fact, they are not asked which county they come from. They just register and they are treated, they are given treatment. And I think that's what happens with all the governors here. We don't ask where people are coming from. And when I looked at the statistics, in my own, the major hospital, we have about 3,500 people per day on outpatient, and about close to 1,500 of them are from outside this county. So, ladies and gentlemen, and because of time, I would have spent more time, but let me say this. But in funding, we have got this 70 acres. It's very difficult to get 70 acres in Kisii. It's not possible. But we have this 70 acres here. When I came here, I said it looks a bit far, but I realized that the farther it is from the town, the better for us. If we can build this, and Professor Mugenda here will tell you that when she was a vice chancellor, the beautiful place you saw there, she built it. It was an open ground like this, ma'am, wasn't it? It was just an open ground like this one. And I think when she started it, people thought probably she wasn't thinking properly. Probably they thought she was among those, is it 4% or? But just look at what this great lady did. This is what this great professor also wants to do here. So let's support them. And in that context, the representative of the Ministry of Education, if you are here, please stand, and the representative of the Ministry of Health. We are going to do the necessary documentation to the Kenya government, including involving the Ministry of Finance. And thank you very much, please sit. So that documentation is in the process of being finalized. And I would want to ask our representative, the representative of the UK government, who is here. Sir, we spoke with you yesterday. Was it that yesterday or the day before yesterday when we were at the High Commission? The day before yesterday, we were at the High Commission residence. And please do thank the High Commissioner, Her Excellency Jane Marriott. She came here to Kisii, and we did tell her about this initiative. We have written to a number of organizations, and I'm aware, Graham, you have already made arrangements to discuss with the World Bank, discuss with all the other development partners, both the bilaterals and the multilaterals. I'm aware that you're meeting a number of them in Nairobi. I'm hoping that I will also be there so that we discuss on this funding. But on our own, we had written to the United Kingdom Export Finance Group about funding this program, and they have written to us, and they have said they have confirmed availability of funds. But you know, don't clap, because those availability of funds are subject to governmental approvals. And that's where this great man comes in. That's where our Kenyan government comes in. When that time reaches, probably you can be told that we have reached certain ceilings, and therefore this money, it's not possible. And that's where now, when we are talking to your own people, that's when you need to come in. But that's only one source. The other sources are sources that I've talked about when you're discussing with the other bilaterals and the multilaterals. find out which ones can actually support us, because it's a major thing in a subnational area, and it will be great for us. So ladies and gentlemen, let me thank you. I had a lot to tell you, but let me thank you very much for coming here. And let me use this opportunity to indicate that we will, after these discussions, we'll be signing a memorandum of understanding with Manchester University here. That memorandum of understanding, I've already received a letter from the Kenya government, from the Attorney General's office, approving the memorandum of understanding. So we will sign it with a full approval of the Kenya government. Let me take this opportunity to invite our chair of the Lake Region Economic Bloc, from South Paranya. We have agreed as governors from the region that Dr. Wycliffe Ambesa Oparanya is going to talk on behalf of all the governors. Dr. Wycliffe Ambesa Oparanya, come here. As you are coming here, there's a young man, Kenyan young man from Nyaribari called John Guto. All this would not have happened. When you look at him, when you meet him in the UK, you see a young man, you meet him in the streets, you wouldn't even recognize him. But this wouldn't have happened without him. Please take our greetings to him. I thank you very much, ladies and gentlemen. Thank you.
Ladies and gentlemen, good afternoon. I want to write on my colleague's protocol, James Ongwae, so I will not go into protocols because he's the one who is aware of who he invited here. I might make a mistake. You want to? Yeah. So, ladies and gentlemen, it's a pleasure for me on behalf of my colleagues to address you. And I want to take this chance also to welcome our friends from UK. Some of them I know this is their first time in Kenya. Now, my colleague Awiti had to excuse himself because he has another meeting in Mombasa, so he has left. So we are left with Governor Siaya, Rasanga is there, and the Deputy Governor of Kisumu, who is representing Professor Anyang'. I'm the chair of the Lake Region Economic Bloc, and James Ongwae is the vice chair of the Lake Region Economic Bloc, and also the vice chair of the Council of Governors. And Ongwae is also the chair of our health pillar at the Lake Region Economic Bloc. For those of you who have come here for the first time, the Lake Region Economic Bloc comprises of 14 counties. The 4 counties in the former province of Western, that is Kakamega, Busia, Bungoma, and Vihiga. And then the 6 counties in the former Nyanza province, that is Kisumu, Homa Bay, Migori, Siaya, Kisii, and Nyamira. And then we have other 4 counties from the Rift Valley who are much associated since independence with the Lake region because of the lake, and that is Bomet, Kericho, Nandi, and Trans Nzoia. So we have 14 governors. Unfortunately, 10 of them are exiting. Their term has come to an end. And we have 5 who are first termers, and they could not be here. You know what is happening in this country. They are running around to try to defend their seats, as we can afford to be here because we are not running for any seat. Now, The Lake Region Economic Bloc is structured into 5 organs. There is the summit. The summit is all the governors, all the 14 governors. When they meet, that forms the summit, and that's the highest decision-making organ in Lake Region Economic Bloc. And then we have the council, which prepares mainly the issues that we have to discuss at the summit. And the council comprises of CECs in charge of finance in all those 14 counties. And then we have the pillar committees, and we have 10 pillar committees within the Lake Region Economic Bloc. The first one is agriculture, trade, tourism, financial services, industrialization, water and environment, and climate change, infrastructure, health, and gender and persons of disabilities, and lastly, education. Those are the pillars, and these pillars mainly comprises of CCs, in the relevant CCs in that particular pillar. So if it is agriculture, the CC in charge of agriculture meet to discuss issues to do with agriculture. And then we have the assembly forum that comprises of all members of the county assemblies within in the 14 counties. And lastly, we have the secretariat, which is headed by Victor. Victor is here, the acting CEO is here around. That is the one who is our CEO at the secretariat. And the Lake Region Economic Bloc is headquartered in Kisumu. I want to thank the Ford Foundation. Ford Foundation is the one which has supported us to establish all these structures that we have in place. We have had a problem on legal issues to do with the economic blocks. In the country, we have 8 economic blocks. The Lake Region Economic Bloc is the most vibrant, but we have had legal issues with the national government. So it has been very difficult actually to actualize some of our objectives at the Lake Region Economic Bloc. Thanks to donors, development partners who have supported us up to this day. Now, coming to the issues of today, I think my chairman has the chairman of health, who is our host, has really expounded on quite a number of issues that we have undertaken to support this program as Lake Region Economic Bloc. But you know, ladies and gentlemen, the dream of our founding father when we got independent was to fight poverty, to fight illiteracy, to fight the diseases, and later, because of the poor governance, it became also an issue of poor governance. Up to now, we are still having health problems. And I want to thank the president to have come up with this universal health coverage. I hope that will help Kenyans. We are so grateful to our colleague James Ongwae, who came up with this idea, and he has pushed it, and he has made us embrace it at the Lake Region Economic Bloc. Those who are asking why Kisii came up with the idea, and we have supported it. And we are grateful that he has, we have now agreed that we shall have the spokes. And that's why these other universities have now been included. The time you mention cancer in this country, if someone tells you have cancer, you know you are condemned to death. The truth of the matter is that I've never heard of anybody whom I have been told he has cancer and he has survived more than 2 years. And I was talking to a professor, one of the colleagues you have come with. Even my own father, when he was told that he had cancer, prostate cancer, after a week he passed on because he knew that he was not going to survive, despite the fact that he was 86 years old. So cancer is a major, major issue. No week passes without you hearing that someone has passed on because of cancer. You remember last week, our friend Michelule lost his wife because of cancer. As you carry out research, you should also find out how cancer treatment will be affordable. Because cancer, when you are poor, let me tell you, you can't afford. It is too expensive. Our professor here said there is a PET scan, but how much do you charge just to check someone? If you go to Aga Khan, you are told to cough over 100,000 shillings. How will one cough 100,000 shillings if that person is poor? Unless there is a comprehensive scheme. How, you know, she says, she talks of 40,000. How many Kenyans here can afford 40,000 just to be checked if you have cancer or not? So as you research on this, can you also please look at the healthcare if it can be affordable, more so cancer, because cancer is killing so many of our people. We appreciate this particular program because it is also going to improve the skills of our people. Because sometimes our people die because we have no skilled people in that particular area and they die. Even they say we have a shortage of staff in most cases, but actually the shortage of staff is artificial in that we are not able to employ these people. We have so many medical staff who are trained out there, but we cannot employ them because of the shortage of funds that we have at the moment. I must be very grateful to the Kisii governor because he's the only one who has allocated 45% of his budget to healthcare in the entire country. I remember when I was the chairman of the Council of Governors, we resolved that every governor should at least allocate 30%, at least 30%. Me in my own county is just 30.4. But him, he has gone all along, he has gone all the way to make sure that he allocates 45%. Priorities, of course, vary from one county to the other, but healthcare is so critical, and that is also the most devolved function in this country, apart from agriculture. Otherwise, we are grateful as Lake Region that as we move on, this is going to be a very, very important program. It is going a long way to alleviate the many problems we have had in cancer treatment in this region. And they say in this region is where cancer is more prevalent. They were saying the cancer of the throat in my county is one of the leading in Kisii. And they were saying that because we take a lot of tea and hot tea, I don't know, there is no scientific evidence, but maybe when you carry out your research, you must look at that. Otherwise, thank you very much for coming. The rest of you, thank you very much.
Thank you very much. Can you clap for him, please? Thank you very much, and for talking on behalf of the other governors. Please, I'm calling you. If I call you, we're running out of time. I want to call the representative of the Ministry of Health, the PS, and the Cabinet Secretary. Please come, and you'll be followed by the representative of the Ministry of Education. You will then be followed by the representative, yes, of the Ministry of Education here. Those two, I'll see if, do we have any other representative here? Yeah, please, if you can come forward, just take 1 or 2 minutes, please. If you can paraphrase the speech, if there is any. Thank you very much.
Thank you. All right, good afternoon. I will take the task as guided by His Excellency the Governor. I will paraphrase, a lot has already been said, so we don't need to repeat quite a bit of it. So my name is Dr. Jared Nyakiba. I work for the Ministry of Health, and I will represent the PS, Susan Mochache. Her apologies first. She wanted to be here, that was the plan, but there's another meeting also between Kenya and the Global Fund, and she's the co-chair of the Kenya Global Fund mechanism, so she also had to attend that. I will, so members of the UK team, all Excellency Governors present, the Vice Chancellors, special mention to Isaac Ibwage, who was my lecturer. I have seen that's the trend, so I'm keeping with it. And the chair of KU, TRH, and representatives of the other state departments in the national government, distinguished guests, ladies and gentlemen. So I'll proceed to read the speech, but I'll skip some sections, paraphrase them, because I think a lot has already been discussed and same thematic areas. So afternoon, I am honored to join you today as we launch this Center of Excellence for Healthcare Education and Training at Kisii University, and the signing of the Memorandum of Understanding, as you have heard. And also this was also mentioned, and I think the Governor Ongwae has already given a very detailed history as to how this memorandum and the alliance came to be. And that last year, His Excellency the President witnessed the signing. Actually, two to one was an agreement, government to government, on health workforce collaboration, and then we have the UK-Kenya Health Alliance, as discussed. And the mission of this alliance is to uplift the standard of healthcare in Kenya, largely around clinical service provision, research, as we've mentioned, workforce, training, and education. And of course, initially focusing on cancer outcomes, but spreading out as you have heard. And this comes at a very opportune time as Kenya has embarked on the national scale-up of UHC, launched by HE, His Excellency President Uhuru Kenyatta last month, February 7th in Mombasa. And through UHC, just to also make sure everyone is aware, through UHC, the objective is that all Kenyans, whether you're short, tall, blue, green, or yellow, male or female, young or old, can access a certain set of essential services, which is what we call the package, when they need it, affordable, quality, without suffering the financial hardship. And I think Governor Oparanya was referring to that. And it becomes very critical to do that. And we are now encouraging all Kenyans to be members of the NHIF. And Governor, one of the benefits there under the oncology package for the UHC scheme is that the PET scan will be covered, 40,000 will be paid for. If you're a member of NHIF, you will not pay anything as a result. So as we speak about cancer, let's also encourage Kenyans to be members, paid up, active members of NHIF. So to achieve this big dream, of UHC, we need to build and strengthen all the 6 pillars. And one of the pillars is why we are here today, to talk about the healthcare workforce and how they are trained. So this particular initiative is aligned to UHC in that it enhances the quality of training, enhances the quality of care that will be provided, by producing a health workforce capable of dealing with the rising tide of non-communicable diseases. And that's why we are talking about cancers. Through this alliance, we have seen that, and I think the professor gave a very good guide around what will happen at Kisii University and the various other spokes, and through that, lessons to the other universities and other hospitals. Number one, healthcare workforce is not just about numbers. You need the numbers of doctors, you need the numbers of nurses, But two, you need them distributed accordingly to where they are needed. We have a problem with distribution. Three, we need them to be productive where they are, right? They do what they need to do. And four, into why we are having this alliance, they need to be competent, knowledgeable, skilled, and of course with the right attitude in terms of providing quality services. So that's what this alliance is aiding towards in terms of the pillar around healthcare workforce. So in Kisii today, as already been mentioned, maybe I'll skip this part, several initiatives ongoing in terms of the Center of Excellence at KUTRH and Kisii Teaching and Referral being one of the spokes, the signing of the MOU, I think Governor already mentioned that, and the previous signing last week between the hub and the spokes, and in particular now to the focus of today, the launch of the Center of Excellence in Health Education. And this center aims to achieve exactly that. How do we achieve as a country, as a region, and as a continent, qualified, resilient, multi-professional healthcare workforce that is key in terms of assisting us to achieve UHC. So lastly, this will also be about capacity building, already practicing doctors, nurses, through various fellowships, training, and technology transfer from the alliance partners has already been mentioned. So I want to end by saying that in this journey to UHC, I hope you can see the spirit today. The spirit is collaboration. The spirit is partnership, right? Which is critical to ensure that we achieve UHC, and we are happy to explore this with the Kenya United Kingdom Health Alliance. And the ministry, Madam PS conveys her support and her commitment to facilitating this alliance. Asanteni sana, thank you. I hope, Governor.
Thank you, you're a good student. The representative of the CS Education, please, if you can also keep up with that spirit.
Good afternoon. I'm representing the PS State Department for University Education and Research. And I'm also a member of the council of the university. The PS Ambassador Nabukwesi is out of the country on official duty, but he highly supports the project, and he sent me with a brief note, and I'll follow my predecessor's procedure so that I paraphrase so that I'm able to read it very fast. It's a very short speech. British High Commissioner to Kenya, Ms. Jane Marriott, Vice President of the University of Manchester, Professor Graham Lord, Cabinet Secretary Professor George Magoa, who was supposed to be with us here, Principal Secretary present, Governors present, His Excellency James Ongwae, Governor of Kisii County, His Excellency Wycliffe Oparanya, Governor of His Excellency Colonel Sanga, Governor of Siaya, His Excellency Governor Amos Nyaribo Nyamira, His Excellency Governor Cyprian Awete, Governor of Homa Bay. I take this opportunity to greet you this afternoon. Chairperson of the University Council and Vice Chancellors present, all protocol observed. It is my absolute pleasure to join you on this auspicious day, a day for the Lake Region Economic Bloc, bringing all of us together as one family. This family yearning for an East African Center for Excellence in Health, Education, and Training. This comes in not only to help propagate premier health training, but also to support one of the big four agenda of attainment of universal health coverage, UHC, in our country. To initiate and deliver on these priorities, the government of Kenya sought input of University of Manchester and Christian Hospital. Together with the partner universities that are joining forces to bring their intellectual, social, and economic power, Kenya shall witness a new dawn in health, service, and education training. Allow me to mention that the assessment carried out by East African Medical Board toward the end of the last year, 2021, Kisii University was ranked third best institution offering Bachelor of Surgery and Medicine in Kenya. Based on this, it is assessed that it is endowed with the resource to mount this kind of project to the higher level. I wish to mention that the proposed Center of Excellence in Health Education and Training, CHED, will be a golden goose for our people, the goose of hope, strength and better services, especially in our healthcare and obstetrics sectors. The center will develop innovations in research, education, and healthcare ventures and improve the quality and availability of healthcare services for our people in this entire East African region and the whole world. Ideally, it will be a key pillar in advancing the realization of Kenya's Big Four agenda and Blueprint Vision 2030. I want to thank Kisii University for taking up this challenge and running with this program. I want to appreciate the fact that it is working closely with other universities as well. The project will make the involved universities lead from the front to help make the community better, to offer solutions for society, and to ensure that the lives of our people become remarkably better than they were before. Ladies and gentlemen, let me conclude by underscoring the importance of this program to our people and by extension to humanity. I appreciate each and every one of you for taking time and putting in the commitment needed to push this program to a successful end. I wish to thank the stakeholders who are with us here today for accepting to come together for this noble cause. I pay special tribute to our UK partners for the considering Kenya as a prime recipient for such an impactful project. I wish to also register my humble appreciation to our national and county government for being in support of this collective initiative, which will be of high value to our people and community. May God bless you, and may God bless our country, Kenya, and may God bless the United Kingdom.
Thank you very much, Clement. You kept up to it. Thank you very much. It's now my pleasure, ladies and gentlemen, to invite the person that we have been waiting for, Professor Graham Lord, the Vice President of the University of Manchester, to talk to us, and I would request that we all stand.
Caribou, please sit. In the interest of time, I won't stand on too much protocol. I will follow the precedent of my friend, the chairman of the Lake Region Economic Bloc. I won't read through a whole list of names, but I'll just say thank you very much for all being here. Your Excellency, James Ongwai, for your vision, bringing all of this together. And you mentioned the meeting that we had in Manchester back in 2019, which, given what's gone on over the last 2 years globally, seems a long time ago now, but actually for this vision is a very short time. And I also say welcome and thank you to the other governors of the counties that are here today, particularly from the Lake Region Economic Bloc. And I had the pleasure 2 or 3 weeks ago to address that grouping by Zoom. And I can tell you it's a lot better being here in Kisii County in person. Thank you very much for having me here. I'd also like to thank the Vice Chancellors that are here today, particularly the Vice Chancellor of Kisii University, who we had the pleasure of meeting this morning before we came here, and also for his vision in supporting this healthcare and training centre of excellence in Kisii County. I hope I've not left anyone out, but the one group that I have left out is the team from the United Kingdom, who've worked tirelessly on bringing us to this point. I will continue to work even more tirelessly as we move forward into actually implementing some of our work. So I'd like them all to just stand up, and I'd be very grateful if you could thank them for coming out. Thank you. So I will keep it brief. I know there are many things that we need to get done, and people have other business as well. But again, first of all, I'd just like to say how humbled I am to be here representing, if you like, the UK side of the Kenyan UK Health Alliance. That again was a pipe dream 3 years ago, and we're starting to see it come to fruition right now. And that's only possible because of the spirit of partnership that we've generated. And I think there is something very special about the relationship between Kenya and the UK. I think it's based on friendship that we've seen here today. And it's just so nice to meet people I've either met on Zoom or meet them again and come out of Nairobi, come to Kisii County, actually to see where the healthcare need and the need for this centre of excellence is most acute. Our partnership is also based on trust. When we've agreed as a partnership, driven by the needs of the Kenyan people and the Kenyan investigators and the Kenyan doctors and the Kenyan leaders, we've delivered. We need to deliver more, but we have delivered. And what that leads to is it leads to trust in the partnership, which is absolutely fundamental as we go forward. We've done, you know, we've gone from 1 to 10, we now need to go from 10 to 100. And probably many more zeros, but we'll cover that off when we speak to our development partners tomorrow. I'm looking at no one in particular in the audience. I think what today also really shows, and as we're being shown around this 70 acres of prime Kisii land and the plans, extraordinary plans, that's come out of a dream, that ambition is shared and profound. We are actually trying to change the world here, how healthcare is delivered, primarily in the first instance for the people of Kenya, and also for the patients and the people of the UK. I think we have as much to learn from you as you do from us. And I think the fact that the universities are younger than ours, age doesn't always bring wisdom, as my daughter quite often tells me, and she's in the audience. We'll come back to that later. So that's the Kenya UK Alliance that has been supported by your president and our Prime Minister. It was a very interesting comment he made when he came over to launch the Global Education Partnership last year with Prime Minister Boris Johnson. He came over to Chequers the day before he met with us in London on the 30th of July. And he said education is really important, it's profoundly important, but actually if your population is unwell or dying, education matters less. The healthcare need that we see across the world, but actually we see right in front of us here and across the whole of Kenya and East Africa, is an issue that we need to address. And in partnership with you, we will do our best to address that through clinical provision, supporting you with that, research and training and education to provide a sustainable healthcare workforce of the quality that's as good as anywhere in the world to every patient in Kenya, wherever they live. That's our ambition. That's quite a bold ambition, but we will deliver this. I'd like to say a few words about why Manchester, why Kenya and Manchester. Is it just because, you know, James and I happened to meet, and then like a snowball rolling down a hill, it's got into this very large snowball now, which it has as well. And I think ideas and leadership like that are absolutely key, but actually support of other people. So you mentioned Susan Machache, PS for Health, who's been over to Manchester twice now, and we've had significant discussions with her and support from the ministry, but also Professor Magenda, I should say, Professor also now of the University of Manchester as well. So as of yesterday, in fact, let me give her a clap for that, please, for Olive Magenda. And as well as those deep partnerships and delivery around Manchester, very, very briefly, before I get to the future, I'd like to just dwell for 30 seconds on the past about the special relationship between Kenya and the city of Manchester. People in the audience may know, and I've mentioned this once or twice before, but that your founding president was a student at the University of Manchester. And in 1945, he hosted in Manchester the 5th Pan-African Congress, where the independence of many states in Africa, including Kenya, was discussed. I think that would only have happened in Manchester. Manchester has been a pioneer, as has Kenya, of political reform, democratic governance, suffragettes, the trades unions, the Industrial Revolution all came from Manchester. And I think that history of radicalism, but peaceful radicalism, and democratic governance are shared between Kenya and the UK. A lot of that came from Manchester. So I think this is a true partnership that goes back to 1945 and will continue on into the future. The other thing, to bring the past a bit more immediate, Manchester is also the only region in the United Kingdom that has a fully devolved health and social care budget. We understand profoundly the challenge of managing centralized allocation and governance and regional and local allocation of governance, and actually devolution around that is very, very important, and actually learning from you and you learning from us in that sense around how you deliver health care and research in a devolved manner based around a national framework is a very, very important area of learning, and that will make what we do today and over the future sustainable. Where have we delivered? I won't go through a list of what's happened over the last 2 years around the partnership. One thing I will mention that we were discussing yesterday when we were in Nairobi was the grant from a UK government agency, from a principal investigator, George Njoroge in Kenya, and a principal investigator in Manchester, Professor Bristow, who sat there, of almost £3 million to be invested in understanding the causes and the treatment in an affordable manner for esophageal cancer. As you know, in this country, a diagnosis of esophageal cancer is pretty much a death sentence. We need to understand the causes of that and how we treat that. We've delivered on that grant in partnership with you, in fact, led by a Kenyan principal investigator. 2/3 of all of that money is coming into Kenya, and Kisii County is a very significant hub in that. That is simply a start. We're going to do similar around breast cancer and the other cancers that blight all of our populations. We know that all NCDs and cancer in particular is going to grow in importance over the next 10, 20 or 30 years. And how we deliver healthcare to address that in a sustainable manner is really why we're all here today. To think that we can continue to pay very, very high bills, to have a workforce that we know is not in sufficient quantity to deliver the care that we need by doing the same thing is not going to work. We need to have blue sky thinking as a partnership of how we deliver this. And that's exactly what this Centre of Excellence here will deliver. We don't know all of the answers. We will walk alongside you. We will take that first step today. How we train our doctors, our nurses, our pharmacists, our allied health professionals for the future is exactly what this Centre of Excellence will discover, how it will work with the partner universities, how it will work with the counties, and critically how it will work also with the Ministry of Health to provide a national workforce, which to my earlier point means that wherever you are in Kenya, you don't have to travel all the way to Nairobi. You don't have to necessarily, take time out from your job and affect your family. And how we do that in an economically sustainable manner is absolutely critical. We do need to get moving with this now. I think sustainable funding for this is critical. One of the reasons we've come out here to show our support this week and to work with you is to present these plans to our partners in this. This needs significant funding to deliver our vision. It's our job to provide that, pull that together, and work with you to show that we can transform the world. We'll start with Kenya, East Africa, and the UK. And I'll close here, actually. I'm going to borrow a quote from Professor Akama, the Vice Chancellor of Kisii University, so I apologise, but what you borrowed it as well, and you borrowed it from Barack Obama, who I'm sure we all know. And I'll probably mangle the quote, as is my Mancunian way, but you know, he said that we don't inherit the world from our parents, we borrow it from our children. In that vein, it's so great to see your students back there. They are the future. They are the future. We do need to get moving. You all in the back are witnesses to what we're doing here today. And in fact, on a very personal note, some of you will know I brought my own daughter with me on this trip to see Kisii and the whole of Kenya, because this is very important to me personally. And when I'm an even older man, I don't want to be sat in the audience listening to her or people like her or your students at the back saying exactly the same thing. We need to get on with this. These are global problems that we need to solve. And I'm absolutely delighted we've taken our first steps here together in partnership. Asante sana.
Thank you very much, Graham. For those who want to see Graham talking and having a meeting with your president in Glasgow, if you look at this photo, which is directly behind me, you will see Graham with the president, and I happened to sit next to him in Glasgow. I think the photo is there, so I stole into that meeting. You know, I stole into it. I stole into your meeting. It's now my pleasure to invite the representative of the British government in Kenya. Richard, please come and talk to us. Thank you very much.
Thank you. Thank you. Governor, Your Excellency James Ongwae, governors, representatives of health, education, universities, and institutions who are part of the UK-Kenya Health Alliance, distinguished guests, ladies and gentlemen, all protocols observed. It's my pleasure to be here today to represent Her Excellency Jane Marriott, the High Commissioner to Kenya. I'm here today with my colleagues Con and John, our experts in devolution and our representative in the Lake Region Economic Bloc. And that's just an indication of how important we see this initiative and this region for UK-Kenya collaboration. It's fantastic to welcome the team from Manchester. From Manchester University, Christie, it's a long way to come. And I just want to say thank you for coming this far. And it really does indicate to Kisii and the Lake region how this is a first step, but there are many to come. And it's great that we've started off on this right foot and that this collaboration is evidenced by the strength and the size of the contingent coming from Manchester. So thank you for joining us here today. But also equally, I'd like to thank the other partners from Kenya side, the Kisii University, the Masinde Muliro and Museni universities, and the KUTRRH also for your partnerships and being here today. UK and Kenya have a strong partnership covering many sectors, including mutual prosperity, how both our countries can grow economically, providing jobs and increasing trade and investment between the two countries. On climate change, as witnessed at COP26, on international development, we've already heard about the Global Economic Summit, which was chaired by Prime Minister Johnson and President Kenyatta, and also in security. I believe the health sector is a fundamental part of that broader partnership. Universal health coverage is a key part of the Big Four agenda, as you all know, and Kenya's progress in increasing funding to the health sector towards meeting the Abuja Declaration is commendable. And I very much hope that that continues as we have another new government coming in. As a devolved function, it is important to recognize the role played by counties and governors in delivering health services. And I want to congratulate again the governor of Kisii. Allocating 45% of your budget to health is phenomenal. The UK in the health sector is a proud supporter of maternal and newborn health, of family planning. We are supporting devolution, which, as I've said, is a key vehicle for supporting health in Kenya. We're also supporting Kisii to develop its urban economic plan, which many of you will also be familiar with, along with 11 other cities throughout Kenya. I just want to finish by saying I'm truly inspired by the vision that's been set out by so many people here today, the governor, the universities, colleagues from Manchester, but also people before them. I'm confident that whilst the governor mentioned that Kisii is famous for its sandstone and bananas, that I'm confident that the Centre of Excellence might be added as a third pillar to that issues for which Kisii is famous. And so I'd like to just end by saying I'm honoured to be here to see the planting of this seed, the signing of this memorandum, and I look forward to seeing this bear fruit in the years to come. Thank you.
Thank you very much. Richard, they say the great things normally start with the first step, and that first step is what you people are helping us start with. Ladies and gentlemen, we almost coming to the end of this program. But before we sign the memorandum and end the program in the next 10 or so minutes, I'm asking Architect Mataya Maroria. Mataya, you did give a presentation out there on what we expect this campus to look like. I would only give you probably about 2 or 3 minutes. Just give a broad perspective in 2 or 3 minutes, please. Not more than that. Is that okay? Thank you.
Thank you very much for inviting me here. Your Excellencies, honorable ladies and gentlemen, and our esteemed guests from the United Kingdom, protocol observed. My name is Architect Mataya Maroria. I'm a partner at Creations Consult Africa Limited. I'm here with Senior Architect Kefa Osoro and my son Elvis. Our firm was approached to provide the concept design for the Center of Excellence in Healthcare, Education, and Training project at Nyosia, Kisii. I asked the IT people to be showing you the video, and they will also show you some still photos. This presentation will highlight the planning considerations we have made based on the brief provided by our liaison John. This presentation was made to His Excellency the President, Uhuru Kenyatta, during his working visit to the United Kingdom in July and November 2021. Now the site. The site is 10 kilometers from the Kisii University main campus and is situated along the eastern border of Kisii County and Nyamira County in the western region of Kenya. The site is bordered by River Kuja to the east and close proximity to the Sotik Highway to the west. From Nairobi, it's 303 kilometers, which is about 6 hours drive. Topography, the site has considerable undulation in slope with about 51 meters difference from the highest level, which is around here, to the lowest level, and is nestled in a relatively developing residential neighborhood with scenic views of the surrounding hills. The site is roughly P-shaped and is more pronounced towards the northern side and is 70 acres, as has been mentioned. The planning has been done to establish clear hierarchy, setting the public areas to be more accessible on the lower side and residential at the crest of the hill. Nyosia campus environment is designed with a teaching hospital at the heart of the site and other facilities radiating from it. The hospital is mainly accessed by the grand entrance with a wide tree-lined 4-lane drive, which then leads to a circular drive directly linked to the hospital emergency center. The commercial and recreational areas like the hotel, swimming pool, fitness center, student center, and non-denominational chapel grounds are kept within the public view to act as a live element connecting the university to the neighboring communities. The teaching medical schools radiate around the teaching hospital to establish the movement of students with skywalks and proper learning environment for the students. The south is where the staff apartments and the university academy will be situated. At the apex of the hill is where the overhead tanks and reservoirs will be installed to ensure continuous supply of water at the university. The road network has been designed with respect to the land terrain to ensure easy access to each of the buildings. Provision has been made for sufficient parking for both visiting public and the regular university residents. Solar panels will be installed to provide shade in the parking lots and harness energy from over the 10 hours of sunlight that Kisii enjoys. Paved walkways have been provided with proper designed curb ramps which flare up to allow for free flow of wheelchairs and access to the walkways. Bearing in mind the land scarcity which we have in the Kisii County, we have developing a futuristic design which has provided for foundations to allow for future vertical expansion of each of the buildings. Water supply will be from national water mains as well as rainwater harvesting. A sewage treatment plant comprising storage chambers and clarifiers have been provided for in the lowest part of the site. Now, the schedule of areas. We have the administration block, there is a research center, there is the library, and then the pediatric center, which are now the hospital complex, which has 50 beds, cancer, diabetes, and heart institute, 150 beds, maternity hospital, 30 beds, mental trauma and rehabilitation center, 50 beds, a general patient department, 450 beds, the blood bank, and a funeral home. The college has these different schools: the School of Medicine, School of Dentistry, School of Pharmacy, School of Nursing, School of Laboratory Sciences. There is a 4-star hotel with a student center and a non-denominational chapel. There is a sports and fitness complex, a swimming pool, the university academy, and a female and male hostels. Then there is also provision for the staff. There are 6 blocks which are going to provide for the residence of the staff, the senior staff, so that people don't have to go out of here to go and do their shopping or to do anything. As I finish, Your Excellency, the design of this campus of excellence for health, education, and training will preserve most of the natural environment around the site. My aim as the lead designer is that the Nyosia campus will be an emblem of sustainability and preservation, not only of human lives, but also of the natural environment on which it sits through the use of locally sourced materials and talent. We are grateful to the Governor Ongwae, Professor Micheka, Professor Kibwage, as well as the VC, Professor Kama, for being initiators of this transformative project for the region, in line with His Excellency the President's vision to make Kenya a medical, training, and tourism destination. Thank you very much.
Well done, Maroria. My recommendation is this. Your entire group, I do hope, Professor, that you say they are working together with the architects from the county. I would ask Professor Micheka together with Dr. Kamarogo, if you can all go to Kenyatta University, see the physical planning of that university hospital, and you'll be amazed. Because it's extremely important that the physical planning itself comes out well. The second thing is, Professor Keith, this is where you come in. The conceptualization of this training facility transcends the normal type of hospitals that we are talking about, like my teaching and referral hospital. This was a slightly higher level type of concept. So the design itself is extremely important. I would suggest that they send you the drafts and you can give them comments from Manchester before we completely clean up this, including the whole issues of the financials and the costings, how best they can come out. I do make, please, if you can do that, make sure, Matoya, that you visit Kenyatta University Teaching and Referral Hospital. And I think that's probably that's a directive now from me and the Vice Chancellor. That is extremely important. That you also talk with get all the details from our brother here in the UK, and they will give you their own views. Ladies and gentlemen, we are now coming to the close. I am asking the Kisii University legal officer and the Kisii County Solicitor General, I don't know if the county attorney is there, if you can all come forward here so that we can finalize the signing of the memorandum of understanding between Kisii University, Kisii County, and the Kisii University Hospital. This will be superintended by the spokes. The spokes will witness this because it's being signed by the hub, so that we can tie down our discussions today. And that will show you, Graham, that we probably are heading somewhere. We are hoping that with your support and the support of everybody, that this program and the project will see the light of day. Thank you very much. Who is guiding this? Please guide us very quickly. We want to be out of here in 10 or 15 minutes, not more than that. And make sure that you have got the flag of the UK there. Have you got the flag of the UK? Have you got the flag of Manchester University? Those, Vice Chancellor, who is signing from Kisii County government? I hope it's not the governor. Who is signing? Where is Sarah? Where are the people? Where Dr. Ondari? Where are you?
just a minute, band. Please, let's be guided that here we have His Excellency, our governor. We have a representative from the UK, Professor Kama. Then we have the advisory. Please, Your Excellency, Governor, the chair of the Lake Region Economic Bloc, Excellency Oparanya, please come forward and witness. The rest of us, please, let's follow that order so that we allow those who are supposed to be there to have a place. Excuse me, just 1 minute. 1 minute, please. Let's have order here in the signing. I can see some people who are not in the list. Let's step back kidogo for 1 minute. Tukanyaga chini tuonyeshe heshima kwa wageni wetu. If you are not in the list, Kumuranche, naomba tusonge kando kidogo. Asante. Okay. Okay. Thank you. Now, naomba tafadhali, let's all rise as we celebrate this wonderful achievement from the Kisii County Government, Manchester University. Tafadhali, naomba, I ask you kindly to raise up your memorandum to display them up. Can we celebrate in 1, 2, 3? Thank you very much. I'll now ask the team from UK to remain here on stage, joined by the governor of Siaya and the deputy governor of Kisumu for a photo. Please, the rest of us can be seated. Please, Professor Kama, you remain. The team from the UK, please remain for this photo. Please join, please, team from the UK, join. Thank you, everyone. Thank you very much. Thank you very much, Your Excellency. Now, I kindly
the legal officer both for Kisii and for the university, can you please come here? Can we now have a vote of thanks from Dr. Matthew Owili, the Deputy Governor for Kisumu, on behalf of the Governor for Kisumu, who is the Chair of Health in the Council of Governors, and who would have given the vote of thanks, but is not here, but the Deputy Governor is now the Governor. On his behalf, please give us a vote of thanks. Thank you very much. After that, the protocol person take over. Let's have the necessary protocols as we finalize. But let me say this, because I'm not coming back here. Kenani, I hope we are right. We are leaving, you know where we're going for lunch. You all know where you're staying, we'll go there. And then after that, we'll go to Kisii Teaching and Referral Hostel. For the governors, you are leaving for the sports club, for the summit meeting of the Lake Region Economic. Thank you very much, ladies and gentlemen, and be blessed.
Thank you, Governor. All of us here gathered have been part of a very important history written this day in this audience in the great county of Kisii. Allow me to ride on the observation of the governor of Kakamega and the chair of the Lake Region Economic Bloc in observing that the dream of our forefathers of acquiring affordable quality healthcare for our people remains on course. We all know that for that to happen, for that dream to be achieved, then training is key, research is key, and human resources for health is key. So today we have this particular MOU signed to help bridge that gap that will help in realizing that dream. Allow me on behalf of the Lake Region Economic Bloc and my governor to thank the representative of the British High Commission who is here with us. Thank you very much. Allow me also to thank the United Kingdom delegation of the Manchester delegation led by Professor Graham Lord, the Lake Region Economic Bloc governors led of course by the chair, Governor Oparanya. Governor James Elvis Omariba Ongwae, a very great example and one of the leaders in this forum and in the Council of Governors. Thank you so much for your leadership and for making this happen. Now the universities here represented, those who have the spokes, and of course the hub that is the Kisii University. Thank you very much for making this a reality. The advisory team, I maintain that if you have Professor Kamarogo, you have Professor Kibwage, and of course the rest of them who are introduced up front here, there's no way you can go wrong. Thank you so much, Professor Micheka, and of course Olive Mugenda. When the history of this country is written in terms of
higher learning. I think we'll have so many pages dedicated to you. If not books, just dedicated to the two of you because of what your contribution have been. We recognize the support and the work that has gone into this from those who lead the health and sanitation dockets in the various counties represented the Lake Region Economic Bloc. And of course, you have quite a number of partners here, those who are invited, those who have come to witness. If you can see me, please raise your hand. If you can see me, raise your hand. I want to thank you in person for making time to come. Now, we have a very history between the UK and Kenya. You realize I did not say UK, I said United Kingdom, because down here we have a county which I represent here today that also refer to themselves as the UK. But now they are United Kisumu, not the United Kingdom. And of course, you know Manchester and our country. I know that my brother from Bolton did talk about the Bolton Wanderers. But in Kenya, probably we have quite a bit of support from Manchester United. Quite a number. So we have quite a number of things that bring us together. Some of them, what we have done today, some of them socially. Later tonight, I think at the Emirates, the Arsenal #1 fan will be watching football there when Arsenal is playing Liverpool. So that's how close we are with you. So we appreciate and please hold our hand as we actualize this particular dream. Thank you so much, Governor of Kisii. You've been a great example. Asante sana, and may God bless all of you.
Thank you. Let's appreciate His Excellency the Deputy Governor. I kindly ask you that now we may all rise for Kenya National Anthem, followed by the National Anthem of United Kingdom as we finish. National Anthem. You okay? Thank you very much, our band, and that marks the end of this launch of the Center of Excellence in Health Education and Training at Nyosia. God bless you. May you have all journey mercies. Thank you. You will allow His Excellencies and our delegation from UK to leave first. The rest of us, please remain seated as we guide you on how to move out. Thank you so much, Your Excellency, our Governor, for being a wonderful host. Our VC, thank you so much, Professor Kama, the team that supported to make sure that this thing worked. God bless you, the Secretariat, led by Dr. Kenani. Yes, as you agreed, the afternoon program will remain meeting at Kisii Teaching and Referral Hospital after lunch. Thank you so much, my band. You guys are amazing. PJ, my brother, the technician, God bless you. Kisii University traditional dancers, be blessed. All the ushers led by the protocol team.